Good afternoon, everyone, and welcome to the Black Health Trust, where we talk about and discuss matters that are of health that are important to our community in a way that makes sense for real life. Today, we will be talking about how AI can be used and is in helping with healthcare questions and how it's changing how people get answers to their healthcare questions. Um, and currently. So today, we will be talking about how accessible everyday tools can be to help you stay informed and make better decisions and ask better questions in regards to your next, healthcare appointment, as well as understanding your health in real time. So we will be replaying a video that where we discussed how AI can support you in your health journey. And afterwards, we'll come back and see if there's any questions or additional reflections that we have on the topic. So let's go ahead and get right into it.
We are so happy that you chose to spend this time with us, and we are going to jump right into what I suspect is a very probing conversation this afternoon. And without further ado, I will turn it over to our founder, Dr. Randall Maxey.
Thank you, Dr. Barbara Davis-Stevens. Hello, Dr. Walks and Dr. Hines. We are very excited to have a discussion today on something that's hitting all the buzz on the TV networks and newspapers. We're going to talk about medical AI. In fact, medical AI is a revolutionary healthcare diagnostic, treatment, and prediction event. AI enhances accuracy in radiology, pathology, and surgical decision making. We explore AI's impact on preventative care, clinical workflow, and patient outcomes. This session will discuss practical uses and future implications of artificial intelligence in medicine. Our featured speaker is a good friend, Dr. A.J. Ananda. He's a board-certified neurosurgeon specializing in pediatric and adult neurosurgery. He's a former head of neurosurgery at Kaiser Sunset Medical Center in Los Angeles, and he's a principal in Dr. AI, which is the product we're going to discuss this morning. And I have met his father and mother by phone, and I'd like him just to briefly, as he comes, to give a quick introduction to them. And Dr. A.J. Ananda, appreciate you agreeing to speak with us today and entertain some of the questions we're going to put to you. Thank you.
Thanks, Dr. Maxey. I appreciate the opportunity to come on your program, and it's always nice to see you. I've been on here before years ago, and it's nice to be back. I hope I didn't wear out my welcome last time. Also, I'll introduce my father, who is really the head of the company I'm going to talk about called Hey Dre, and it is an artificial intelligence tool designed specifically to help patients, the individual medical consumer, on any issues with their health. And let me give you a little background in the just kind of like the idea behind it. So if you look back at one of the biggest changes over the last 30 years, just in American society, world society, human society, is the democratization of knowledge, right? So when I was a kid, we didn't have an encyclopedia, and people who had encyclopedias, you were kind of like jealous. You had to write a book report or report on anything, or if you wanted to find out anything as a kid growing up in the 70s and 80s, you either had to get to a library or find somebody, go to somebody's house or an encyclopedia, and you can get like a small blurb on, oh, okay, what does a chimpanzee look like? Or what does a toucan look like? What do they like to eat? But if you didn't have a certain window into whatever you're learning about, most of the world is foreign to you. And with the advent of the internet and the kind of popularity and widespread accessibility of smartphones, the whole history and abundance of all of human knowledge is essentially at your fingertips all the time. And so now I grew up in a house where neither my mom or dad aren't handy at all, would never be able to change the light bulb, leave alone change the oil in a car or rebuild an engine. If I want to, I have an old Mustang. If I want to like rebuild the engine, take out the clutch, install a new starter, all of these things I've done by myself with with the most important tool being my phone, teaching me how to do it. And as such, over the last 20 years, as knowledge has become democratized, available to everyone, and for the most part freely, it has expanded a lot of things and a lot of opportunities for a lot of people. One area where this hasn't reached people to the same level it will over the next 10 years is in the form of healthcare. So if you are sick or your loved one is sick, you're often at the will or mercy of your access to a doctor. And if you don't have people in your family or close friend group that are other physicians, it's very hard to vet the good from the bad. Can you even get an appointment? Can you get an appointment with the right physician? Have you had the right test? What do the results of your tests mean? All these things can be very mysterious and often frightening and intimidating. The value of the product we're going to talk about, Dr. AI, is the ability, just like now you have the entire Library of Congress and the history of human film or whatever, all music on your phone, you can have a doctor in your pocket ready to talk to you about whatever question you have at any time. 24/7. So just like you can, in the middle of the night, Google, oh, I want to see a samurai movie on YouTube, and you can certainly find one. But if you had an earache, or if you recently got diagnosed with a weird blood disorder and you got the lab test back and you don't know what this means, are you safe? Are you not safe? Dr. AI is a interactive artificial intelligence that you can type in questions. It'll ask you for very pertinent information that'll help get you to whatever specific answers you're trying to get to in the most efficient way. So that's just a quick, Reader Digest, or, if you're my age, Carol Burnett version of the story. Probably what would be easiest is, ask me questions and I'll try to answer them.
Okay. So prior to the program, we were talking about the sources that the AI process uses to get its information. And we emphasize on this program that we use vetted, well-respected physicians who've published and written, and we respect them and their information. So how would Ms. Jones from First Baptist Church get a good answer and knows it's reasonably good from Dr. AI?
Yeah, so let's talk about it operationally. So the way this works, this is a website, and you can go for free, Heydray, HEYDRAI.ai, Heydray, and all it costs is you putting in your email to sign up for it. And once you sign up, it'll start a conversation as if you're having a conversation with your doctor. And it's not open Monday through Friday, 8 to 5, but it's a program, it's a machine, and you can start this dialogue with it. And once you introduce yourself to it and whatever the Mrs. Jones problem, you may say, I have abdominal pain, I have a tummy ache. And then it'll ask, okay, what's your age? It'll ask questions specifically, about the problem you're having. And it'll guide you to whatever information you may have had, whether you've had any blood tests, x-rays, ultrasounds, and it'll give you easy ways for you to either input your information, upload your information, whatever is like easiest for what the information you have. And then it'll give you specific, a differential diagnosis, next steps, treatments, all tailored to the information you've given it. Now, then you can ask, Dr. Maxey, that's a very good question. How does Ms. Jones or any other user trust this information? Well, the nice thing is it's going to give you an answer, and if you've ever worked with any other, search engine, you can ask more detailed questions, specifically asking, what are the sources of this information? So you can trace it back to its original source. That's one option. The other way is that this is not supposed to be in lieu of having, seeking an actual doctor. This is to provide you some background material and to help you when you see a doctor, you can have a more informed consent, a more informed discussion of what things it might be. Or you may even have to remind, well, what you can ask your doctor, well, what about this? What about that? Can I have this test? Can I have that test? And what people will find, I used the analogy before, if somebody tells you, oh, the sky is green today, well, it's easy enough to test. You walk outside, you look up, and you can see the sky is blue. For something that the knowledge is a little bit more restricted, so if they say, well, your ejection fraction is a measure of your heart function, and you have a test that says it's 28%, and you want to know, is this healthy for my age? Is this unhealthy? What foods I should do? Are there exercises I should avoid? Medications I should avoid? That is something that, finding on your own may be very difficult, but using a virtual doctor where you can ask questions repeatedly, you can ask where the answers are coming from, that's the real value. And so to make sure I'm hammering directly on the question that you asked, to believe the source, you may want to, so is this information coming from, the National Institute of Health? Is it coming from Sports Illustrated? And so I think the key is, depending on how involved, how curious you are, you can kind of dissect that onion to try to get to the very bottom of it. Some people will take it on face value, and that's fine, and they'll believe it based on the way the answer is given in relation to other answers or other questions that you're involved with. Other times you can be very direct and say, well, how do I know this? How do I know that? And if you're satisfied with the answer, great. Otherwise, it can direct you to, just like when you read a scientific paper, often at the end there are footnotes as to what resources the paper is built upon. And similarly, you can keep asking questions to get to the source material.
Well, thank you. That's Neighbor Stevens.
Well, I'm going to go ahead and ask a question because it's an excellent question in chat. One of the audience members wants to know, how does this differ from Perplexity AI and ChatGPT? Is this an app?
So both great questions. Currently, it's just a web-based program. Within the next 3 to 8 months, we'll have an app. So that's the second answer first. It's not yet an app. It's a web-based program that you can use on your phone. You can do it from a laptop or regular computer or your phone, but it doesn't sit on your phone architecture like an app yet. That will be coming soon. That's the next iteration. And how it differs from ChatGPT is ChatGPT, one, has a more narrow database from which it's searching from. That's on the production end. On the input end, with ChatGPT, I use ChatGPT a lot for planning trips, or looking at nowadays solving math problems for my kids, or for a variety of things, like places to go, restaurants to eat at. But however effective ChatGPT is, it's really based on the questions you ask. So for a non-sophisticated medical person, the advantage of Dr. AI is it will ask you questions as if you're talking to a physician. So if you say, like, my stomach hurts, it'll ask, okay, what did you eat? How long has it been going? It'll ask you the questions by which to get the information so it can most narrow down and optimize the data it's searching from. That's why it's going to give you the most optimal answer. It's going to make sure that you give it the information that's most germane to the problem you have. And that's the architecture of the program itself. So one, it will be able to narrow its own search. And so that's one difference in ChatGPT. And the other difference, it has a broader set of information it's searching from.
Thank you. That's Ivan Walks.
So let me give my disclaimer first. Every time I hear AI, I have horrible flashbacks to all the Terminator movies, and I saw the recent Mission Impossible movie. It always ends badly for the humans, right? No matter how it starts. So I am beginning, though, to try to act like I'm not an old person and just connect with the whole concept that AI is something that is here and is helpful. My question, though, is Dr. Maxey started by saying how the information that we give on Black Health Trust is vetted information from folks who have, published and what have you. When Dr. AI is looking for the answers, is it only looking in places because we're getting a lot of different medical information now. Vaccines are good, they're bad. The COVID vaccines are good, they're bad. I mean, everything is good and it's bad at the same time. So the question would be, how do we know, or do you know, or is there a way to look and see where is Dr. AI getting the information and how are the algorithms in that particular process vetted and built on real solid stuff? That's a very long question, but you understand what I'm asking.
100%. And so I'm going to answer in three parts because there's really three questions in one. First question is, it's a philosophical one. Is AI going to hurt us or help us at the long run, right? Like the Mission Impossible Terminator scenario. And the question and the answer is, one way to find out, we don't know, right? We don't know because right now, in all those movies, Terminator, Mission Impossible, the AI has become what's called AGI. It has a conscious and desire of its own, and the motives of this new entity, the AI entity, aren't necessarily aligned with the desires and motives of humans. Where so we can just say we can kind of like blank all of humanity into a single desire. Is like we want to persevere. We want our kids to have a life. We want our grandchildren to have a life, and so on and so forth. That's our kind of like if you take that as humanity's goals, that may not be aligned with the next kind of like superconscious AI. So the good news is we don't have a superconscious AI yet, but that's a really good question, and I'm not really sure humanity has the answer. And when you find out, it may be too late. So that's a real existential threat of AI. That's a different AI than the one we're talking about. The one we're talking about is merely a tool. It won't have any motives or anything like that. It's only a raison for existence is that as a way of consolidating information. All right. And it has two mechanisms that are really unique to the Hey Dre that do it. One is how it pulls information from the consumer so that it can more narrow down the substructure of data it's trying to get. And the other is how it searches, like if you look at the entire tome of digital information, so that's PubMed and all, all of the Google searches and ChatGPT, the OpenAI data structure. And so that's the second question is, okay, how does it actually benefit? Because there are so many things in modern medicine that are controversial, right? Who should get a COVID vaccine? When is it safe to get a flu shot? When is it, so these are all, these all can fall under the subcategory of controversies of modern medicine. And so the truth is, if you ask like 10 virologists, you're really going to get two answers. I think 7 of them are going to say most people should go vaccines. 3 will not, right? That's kind of that's the nature in so many things in modern medicine. And so this is not going to eliminate controversies. In times when the answer to a specific question, so in this case, I'm a 53-year-old guy who is relatively healthy. Should I get a COVID booster this coming fall? The answer will reflect the kind of the state. It'll say that the vast majority of people, given your age and your exposure risk, will suggest that. But it'll have a disclaimer. There are people that say it is unnecessary because your risk of real and moribund disease is low. So, and that's the best answer one can give on this controversial subject. If you can say, yes, for sure, you need to get a COVID vaccine, that I wouldn't say that's a great answer. And if you say like, no, it's not right, that also wasn't a great answer. But based on the best knowledge that we have available, the answer would be this. And so for areas that are clearly controversial in medicine that are not completely fettered out, for example, if you have lung cancer, you shouldn't smoke. Or if you have emphysema, you shouldn't smoke. You shouldn't you should restrict going to humid places. These are relatively non-controversial subjects, right? I mean, heart failure and different inhalers. There's the right there's the right combination of medicines and there's the wrong combination of medicines. The vast majority of things that predict that deal with specific treatments for illnesses, these are relatively acontroversial, and the data will bear that out. And I think it'll spell it out as such. But for the very inquisitive and, say, skeptical thinkers among us that don't want to take just the answer at face value, you'll have plenty of that. The information is given to you in the form, it's texted. The next iteration will be via speech. That's probably 3 months away. But right now and it can be in multiple languages also. Right now it's in English, and it's you text a chief complaint, it'll ask you a question, and it'll be a dialogue like that. You can ask further follow-up questions, like I say, tracing all the way back to the source. And when it's a subject that's somewhat like when I graduated med school in 1997, the use of beta blockers in heart failure were relatively controversial. There are people that say yes, people say no. Now that controversy is more or less squared away. So this changes from year to year, even sometimes month to month. And so that's another difference between this and ChatGPT. ChatGPT exists on a data structure that was updated, I think, last in October of 2022, whereas this is live. It's always being updated because it searches PubMed, ChatGPT, and then the greater internet also. And since I'm not in the programming space, I'm not sure the algorithm by which it prioritizes Lancet this much, NEJM this much, a small cohort study. So I think that's a very good question. I think the next iteration, and for the professional product, which we don't have out yet for physicians, that'll be part of it, is displaying in full force. And we can open this up to the individual, just the lay people as well. The dials, how much we value one publication, one type of study, looking at p-values and perspective, what we call class 1 data versus class 2 data. But all that, when it comes to the layperson, is a little bit, even for me, who I don't do a lot of actuarial analysis, and I know a lot about neurosurgery, but not much about heart failure or liver function or renal disease. I'll take it on face value, and if there's a controversy in the subject, it should, like the COVID vaccine is a great one. There should be a disclosure, and I think that's very important. But for most treatments, for a very specific medical problem, most of medicine is protocol driven. If you have lymphoma at this stage, you're going to get this type of chemo regimen for this 3 months, and you have to worry about this type of side effects. And these foods make these side effects worse. These medications, makes these side effects better. So these are the kind of information that, if you have friends that are oncologists, or if you have access to a nurse that delivers that chemo, it's very easy when you or a loved one is going through that type of cancer treatment. But for the vast majority of people that don't have access to it, to get those answers in a conversational way is very, very, very valuable.
Well, thank you.
Thank you very much.
Dr. Hines.
So I have a bunch of questions, but I will try to hit my top two. The first one is around, you mentioned that you give it a bunch of your information, right? You upload your lab results, your studies, blah, blah, blah. As we just saw with the whole 20, as we just saw with the whole, huh?
At your disclosure, you can give them nothing but your name if you like, but the more information you give them, it'll give you a more nuanced, detailed information.
No, understood. And so then the first question is around what happens with that information, right? Because where I was going with that question is, once we had that whole thing with 23andMe, right? You have some other entity has all your information, and then it's no longer in your control, right? So what happens with your personal information? The second question that I have is, while Dr. Walks gets visions of, Terminator when he thinks about AI, my concern with AI is that it, especially in the clinical spaces, it is trained on a system that created health inequities. So I'm concerned about the exponential amplification of those inequities, because the computer AI was developed by people, and the patterns that it's looking at also led to the situation that we have now. So how does Dr. AI kind of address or make corrections for or do anything to address that?
Right, two questions, and I'll answer the first one first. First question is, first of all, you're right. You are the person in control of your medical information, and that never changes. Even when you go to a doctor, if you go to Cedars is the custodian of your information, right? So like they have your blood tests, they have your MRI reports, they have your doctor reports and part of their electric medical record, and they're the custodians of that. But you really are the owners of that information, meaning if you whenever you want, you sign a thing and they give it to you. If you want to send it to me because you want my opinion as a physician, that's fine. There's a legal process by which to share that with another individual, another doctor's office, another hospital. And so this is no different. Once you upload your information or whatever information you disclose to the program, there's a absolute, it's bound by the same laws of HIPAA as any other medical custodian relationship. So just like when you get an X-ray or you go to like an imaging thing on Ventura Boulevard for your head CT, they're bound by law that they keep track, right? Obviously they scanned you. They have a digital copy of that record, and then they're sent it to a radiologist. The radiologist reads it, and that radiologist has looked at your pictures. But they're all contractually, by law, obligated. They can't share that information with anyone without your approval. And just like the random imaging center on Ventura Boulevard or the random hospital where your kids were born, so they saw your blood, they had to know their blood group and the blood type and whatever events happened when you had children. By law, you can have them share that information with anyone you choose, or you can share that information with anyone you choose, but they cannot without your explicit approval. And Dr. A is no difference. So there's no with 23andMe, I did that, my wife and I, but I don't remember the disclaimers, but there's no situation where with 23andMe where they're a doctor's office or anything like that. So maybe they are not bound by those same regulations, but with this, I can tell you with Dre, it is bound by the same HIPAA legislation and rules of medical information as if you go to see your gynecologist or your orthopedic surgeon. It's exactly the same. So there should be no difference there. So they can't share it without your explicit written wishes. They can't share it with anyone. Now, the second question about the inequities in health, that's I know I'm paraphrasing, but is that a fair description of it? So whenever you see an allopathic physician, right? You go to see the eye doctor, and so in the African American community, there's a higher rate of glaucoma than in the white community, and so a lot of times there's cataract disease, let's say, and when they look in the back of your eyes and they see, they do a fundoscopic exam, and they're looking at your retina and they see uncontrolled hypertension, for example, if that's what they see, or disease of atherosclerosis. If they, depending on their biases, they may or may not assume, this person looks like this, so they're going to have a certain level of hypertension that's not controlled, or hypercholesterolemia that's not controlled. They may or may not factor that into what's best for your vision, right? They may or may not. That's the concept of bias. That's the concept of inequity in healthcare, because the provider is making a snap judgment, either subconsciously or consciously, that takes into consideration something other than your health, right? That's the whole idea of when you talk about the inequities. At least that's the belief, right? That's the belief that, there's a study, I think it was been 10 years old now, but in the New England Journal of Medicine, that Black patients in America get different levels of pain control than white patients post-operatively. Okay, and that means something to me because I'm a surgeon. But that's not because of the system. That's because a surgeon, some provider who's doing the service, is making some decision biased, not on the surgery that he did or the patient or the problem with the patient is having, but on something else, on information that's not pertinent, right? Like their race, their gender, whatever. So the nice thing about an AI, it's dispassionate. It's not going to know that, it's not going to think, okay, Black people have this problem, I'm going to treat them in this way. It's, to the AI, a black person is as foreign or as alien to it as a white person, as an Asian person, as anything else, male, a female. For it, it's just another data, it's just another piece of data that it factors into it. So if you're white and you're 35 and never had a child and you're a woman, your rate of breast cancer is X, compared to if you were 30 and you've already had given birth to 2 children, your rate of breast cancer is Y. And so it knows that statistically just based on whatever the data says. But it would factor in, okay, this person is an unmarried woman. I'm going to treat this person differently because it doesn't have the bias. So I think your point is a very, very good one, that unfortunately in the modern delivery of medicine, of any type of healthcare or any type of customer service interaction, there is a bias, right? We want there not to be, but so many times there is. But when you're dealing with a computer program or with an algorithm that's essentially the only bias that would be put in there is that which is programmed in. And I can tell you from the people who are making Dr. AI, we're not programming a bias based on race or gender. The only bias is try to get the optimal solution for the medical problem. Now, the more layered question is, well, what about the studies out there? The science, is the science have an intrinsic bias? And that's something that we're only as good as the information that we can get, right? So if you say that, right now, like I said, I graduated med school about 30 years ago. In the last 30 years, people have become more cognizant to, okay, certain medicines, certain disease entities in different ethnic groups respond differently to different medication subtypes. ACE inhibitors for hypertension in Black populations versus Hispanic populations, for example. And that data we're still like early in collecting it. I mean, 30 years as opposed to 80 years in the more greater scheme of things. But as more information comes out, that's more germane to like treating the specific patient. I think, just as we, meaning allopathic medicine in general, are learning and becoming better, the information you get from Hey Dre or any AI, any informatics system will improve as the data improves. But you're always going to be limited by the data. There's no magic that I can think of beyond that.
Yeah, as our co-moderator look at the chat and see if there are any questions, I want to ask you a quick one. One of the things that we've been concerned about are the social determinants of health. Will this be programmed in it, as they have a lot of relevance to communities of color?
I'm sorry, say it one more time.
Social determinants of health have a weight on diseases, morbidity, and mortality. Is this being taken into consideration?
The short answer is yes, because we know that very much that your social background, right? Even something, how much money you have, how much education you have, how much social support you have. Are you married, unmarried? Do you have children in the house? All these things make a huge difference in outcome given any medical problem. Doesn't matter if it's cancer, back surgery, Parkinson's disease, dementia, name the disease. Recovering from COVID, all these things have a factor. And so whatever information, and so that's another beautiful illustration of how this is different from a ChatGPT or just a Google search. If you put a Google search is like, oh, I have renal cancer, what do I do next? As you said, your ethnicity matters, right? Your social background matters. Are you a smoker? What kind of foods you eat, your weight, all these things matter. And asking the questions to get that information is going to give the most nuanced and optimized information to answer whatever the question you have. So the short answer to your question is yes, and it's taken into account based on the questions it asks you, right? It only is taken into account if it looks for that information. And the system is designed to try to get as much pertinent information from the user.
Yeah, I told Dr. Walsh last week that he shouldn't eat barbecue, but Dr. Neighbor-Stephens, any questions in the chat that we need to address?
So I just wanted to circle back. I had mentioned about her first question was about the information being sold. I also want to the information was about the security of the information you give to a machine, right? And so I want to state, not only is it HIPAA compliant, but the way that data is structured on the back end is stored compartmentally in such a way that even if there was like some weird outside person hacking the information, okay, our CTO just messaged me because, again, I'm not in the source or I'm not in the programming business. So he wanted to give me a further illustration of the product's security. The information is divided and stratified in a way that even if one system was hacked, you wouldn't really find out any information because like your name and the data that's associated with it is like it's compartmentalized in a way. It's essentially impossible to share with any other entity without your explicit desire to do that, explicit consent to do that.
So there's a question, there's
I
several
think we
questions,
can-
but there's a question that asks, can this technology or should this, how would this, or how can this technology be integrated into an actual physician practice? And I actually was thinking about the converse of that. And what motivated me in thinking about the converse of this is we are potentially looking at mass loss of access to healthcare in this country. And we have a significant part of our population that hops on Google and asks Dr. Google anything and everything. Anyway, so with access to this technology, let's say, I dial in and say, I got this rash on my cheeks that just has been there for 2 weeks. And every time I go outside, it seems to get worse. What do you think this might be? And the chat and the person have their exchange of information, at the end of which the chat hopefully will appropriately tell this person, well, you need to see a specific kind of doctor and have that appointment as soon as you can get it. However, the circumstances are we are in a society where that access may or may not exist. So the positive question was, should the physician integrate this into their practice? And my negative opposite question is, what have you all thought about in terms of addressing issues of access as we progress in potentially a very chaotic period of time in terms of
Let me
health
ask something
availability?
to your question. Could she upload a picture of that rash? Will it interpret that picture?
Absolutely, yes. So the answer to both those questions. So let's start with the first. Could this be integrated instead of for the patient, for the provider, right? This would be a wonderful tool for a provider. And so, yeah, so when you really think about it, this product has 4 potential kind of like sides to it. There's a side for the lay individual, the consumer, a patient, right? And it's for on the side where it's for the consumer, for a regular lay person, it's to give information, things that, you come with a problem. These are the things that it could be. These are the tests that might be helpful. And it's to educate the patient on the problems, to make that person's next visit with their provider a lot more informational, right? It gives them a lot of background that they can talk to their provider about, and they have questions, and so that'll be a much more worthwhile interaction, having knowledge going into the interaction. So that's for the layperson. Or if the person doesn't have access to a provider and is really scared, just been given this news or just has this new symptom, they can get information that way. Then what you asked about for the provider itself. So as the population goes up and the number of med school graduates stays the same, and people actually, if you look at it, people are practicing medicine for shorter times. So now the functioning doctors, actually, there are studies that show the number of doctors that are actually physician work hours available to the American population at large are actually getting smaller. So we have to have this amplification of efficiency. So something like Dr. AI, where once it's integrated, where a patient can log on, send a picture to the site, describe their symptoms. And even before seeing the physician knows the picture, knows what labs that need to be ordered, has a differential. It can make that next interaction with the patient much faster, more efficient. It kind of essentially amplifies the efficiency for the physician. So that's the next iteration. Again, we're probably 3 to 6 months away to have a physician-based version of this. So I think that so the ultimate question you had is one, can this be useful for a physician? Yes. And can this increase physician efficiency? Yes. And by improving physician efficiency, that's what's going to amplify access to people. Does that make sense? So that I think the short answer is yes. We're at the relatively early stages. Even the website as it's now constructed for people to go on and play with and to use, it's just kind of like an enriched beta testing. So once we have it's like a soft launch. The next iteration, 3 to 6 months from now, will be both for the individual consumer and for physicians, where it can integrate seamlessly into their electronic medical record, where it will pull, okay, Miss Jones has a rash. It can pull, like, what's the most recent white count, SID rate? Are their diabetes under control? What's their cholesterol? Have they had this vaccinations? Do they have any risk factors for lupus? All the, are they allergic to any specific medicines, drugs, foods? So the next iteration is what it can, for the physician's office to seamlessly, or the patient to seamlessly integrate with your own electronic medical record. And so without you having to put information in, it can go back and forth, both input and take out information to make the diagnosis to most efficiently and accurately help with diagnosis, what's the next steps in treatment algorithms, treatment risks. It's the whole aspect of providing care.
Let's go ahead and stop
thank
here,
you.
please, Simon.
And
Great. Thank you all again for listening to this refresher. I just wanted to give you a couple of highlights. Dr. Sherrod's had her hand up for quite some time. Remember this, we did this just a couple of months ago, and since that broadcast, they do have their app is up and is available in the Apple Store and those kinds of things. They are being used, I would say, relatively worldwide in health centers, in hospitals, in that everyday use scenario, like a consumer health assistant that he discussed. It's also being used in research settings as well. There are a couple comments in the chat. One was around how when you use Dr. AI, it asks you for racial and demographic information, which was kind of at the heart of what we were asking about, during that engagement with regard to, bias. For me personally, and just speaking for me personally, I didn't find the answer particularly enlightening, and maybe that's just because, we are where we are with it. And then Dr. Gibson had a question about blockchain technology and whether they're using blockchain technology to disaggregate the data they collect, where disaggregation would be it's being stored kind of in different parts so that all of the information that you input isn't stored all together like a patient chart. It'd be as if, there's a piece of your chart here, and there's a piece of your chart here, and a piece of your chart here, which increases security. Because as you could imagine, if we're going to use like a physical analogy, if someone broke into the room that just had these pieces over there, they wouldn't get all of your information. What I was able to find on the internet, at least for that, is that they are not using blockchain. They are storing their information in private data storage spaces, in like private cloud computing. But it is absolutely something that is a really good point of something they could consider for the future. Could Dr. Sherrod?
Oh, thank you so much. I'm sorry that I came on a little bit after the speaker was introduced, so I don't really know his name, but I wanted to commend him on the production. What I've gathered from the discussion, and there's going to be a Dr. AI, and I'm very excited about AI. It has saved me a lot of time, and it's probably the greatest organizer that I've ever encountered. I know that there are some problems, and actually, we had a retreat this weekend, the Association of Black Women Physicians, and we had a speaker on AI and the concerns that specifically that Dr. Hines brought up concerning influencing the data and the output. I think the question for us is how do we influence the data? Because it's the data that's going in that we are concerned about, which will give you the outcomes. And so in our society, we've been faced forever with inequity in every aspect of our lives. And so my question to you is, how do we get to influence as a people? How do we get in to influence the data so that we can get relevant, equitable information out? Now, I have been using Perplexity for quite a while now, over a year, I guess. But every time I talk about AI, I have a resident who's a family practitioner who talks about how more efficient it has made her. She has more time with her patients now because AI assists her in organizing her notes. And so she can spend more time with the patient as opposed to being in front of the computer. So I want to commend you on your presentation and on developing one that's going to take us to the level of the healthcare system. And I'd like to get your name.
So Dr. Sherrod, this was a rebroadcast from a couple weeks ago. I don't actually, Simon, do you remember the speaker's name? I don't recall. I'm sorry, but we'll get that to you.
I
Oh,
believe it
okay.
was Dr. Ananda. I think it was his name, and this was about 4 or 5 weeks ago.
Yeah.
If you go back on the
Ananda, okay.
YouTube or the Facebook page.
But thank you for your comments, and you bring up a really good point. Dr. Gibson had asked something similar in the chat as far as, how these systems are trained and which is essentially the essence of your issue. Like how do we get in on making sure that the data that is used reflects the diversity of the healthcare landscape in so many ways, right? Racial diversity is just a fraction of the ways that diversity needs to be addressed in healthcare.
Exactly.
But I think there will have to be many, many more conversations in that space. And for those of you all who are interested in AI, such as Dr. Sherrod and myself, making your presence and your voice known in your organizations, in your groups, at your planning meetings, joining those committees, when they come up at your institutions or in your clinics, or whether it's patient panels, because lots of hospital systems are seeking patient input on how they're developing and using artificial intelligence systems. I think that's probably one of the ways that we can universally kind of get in there to make a difference. It is 5 o'clock, and I want to thank you all for joining us today. That's going to be a wrap for us while we and taking this deeper dive into Dr. AI and just kind of considering AI health tools in general. That conversation is not going anywhere anytime soon. So I hope that you all continue to think about new ways that technology can help you in healthcare while also keeping your brain on, right? Like we can't turn our brains off and pass it all over to AI. We do, I think, have a bit of a bias as humans to think that computers are right, but the computers at this point are trained to tell us information in a way that is pleasing, and sometimes it's not always correct. So keeping in mind that AI is a tool. So that's going to require us to stay curious, keep asking questions, while also not being afraid to use technology. And then we will be back for further conversations on this topic and how AI intersects with our communities and health innovation at a future date. So I want to thank you all for coming and have a great afternoon.
And thank you.